Welcome back, everyone. We're going to continue along the gynecologic series and talk about some gynecological emergencies and, more specifically, sexual assault. Any type of sexual contact or behavior that occurs without the explicit consent of the recipient is sexual assault. Rape, specifically, is non-consensual oral, anal, or vaginal penetration by body parts or objects using force or threats of bodily harm, or by taking advantage of a victim who is incapable of giving consent. Some key things about sexual assault and sexual assault patients. When you encounter them in EMS, and undoubtedly most individuals, most EMS providers will encounter sexual assault patients during their tenure or their career. It's important to be professional, respectful, and sensitive to the circumstances, the situation, and the patient. And it's also to understand that both men and women can be victims of sexual assault. An older adage was that when possible, a female paramedic should treat a female victim. But in reality, and looking at best practices and dealing with traumatized patients, this is not necessarily the case. And we'll talk more about that here in just a moment. Rape is a crime, and sexual assault is a crime, and police involvement should be expected. And in most states, EMS providers are mandatory reporters, and you will be required to report this accordingly. You should ask the patient who would be more comfortable with a female or male patient. And this is what I was explaining just a moment ago when I discussed about a female paramedic attending a female patient. The reality is, post-assault, assuming that the patient is not in any life-threatening state or need of intervention, whether there's an airway, breathing, or circulatory compromise, time should be taken to establish a rapport with the patient. And more often than not, patients will connect with an individual on scene, whether that's you or your partner or maybe even perhaps another provider. And in which case that relationship that's established, or that person that patient connects with, should be the one that is transported with the patient and continue through the history and exam. You should limit your examination to a brief survey, again, barring there are no life-threatening conditions, active hemorrhage, or things that may need to be addressed by the provider. You should always protect the patient's privacy and examine and interview the patient with a minimum number of people present. Sometimes this can be conducted best in the back of the ambulance and even on the way to the hospital, providing additional opportunity for privacy to gather information. You should provide medical treatment and emotional care for the patient and recognize signs of date rape or club drug use. If drugs are still in the patient's system, you may see corresponding presentation symptoms such as hypotension, bradycardia, difficulty breathing, seizures, coma, or even death. You do have a responsibility to preserve evidence in cases of assault. Discourage the patient from doing anything that will possibly destroy or contaminate evidence, and be mindful to respect the patient's feelings. Offer to call the local rape crisis center and try and connect at the receiving facility, the facility's case managers or social workers with the patient, and make sure that there is follow-up care available to that patient. You should record the following observations: the patient's emotional state, the condition of their clothing, it's not just his or her, any obvious injuries. For intimate partner violence, physical, sexual, and psychological harm by a current or former partner or spouse. This can occur among heterosexual couples, same-sex couples, and does not require sexual intimacy. Your priority, as always, is your safety, and then immediately followed by your partner and your patient's safety. Sexual practices with vaginal foreign bodies. When a foreign object is stuck in the vagina or the anus, you should keep the patient calm. You should protect their dignity and transport the patient in a position of comfort. Do not attempt to remove any foreign object, and do not let the patient walk. Understand that foreign bodies may be a result of sexual assault. Fisting is the placing of a closed fist or wrist into a body orifice for sexual stimulation and can cause organ rupture. The insertion of live animals into the vagina or anus is also a sexual practice that may be encountered. For any of these cases, you should maintain your patient's privacy. Inspection of the genital area may be necessary, And you should conduct a thorough patient assessment to the extent of verifying the adequacy of airway breathing and circulatory status. Treat these patients as you would with any foreign object. You should not be judgmental. What patients do in the privacy of their own home at their consenting practice is their purview and not up to your discretion or decision making. However, you should transport the patient, and you should transport them in a position of comfort and be reassuring to the patient. Pain management should be considered. If a patient is in pain, we should treat their pain accordingly. Do not attempt to retrieve an object or remove an object and transport the patient with their knees flexed and legs together. This will often provide a more comfortable position for transport for these patients.